Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be talking with Dr. Paul Martinez. He's a critical care medicine physician at Nicklaus Children's Hospital in Miami, Florida, and he's joining us to talk about the clinical perspective on teen vaping. Welcome to Health Professional Radio, Dr. Martinez, and thank you so much for taking the time.
Thank you for having me. I'm glad to speak with you.
Now, I did, of course, mention that you are a critical care medicine physician there at Nicklaus Children's Hospital.
Yes. I'm a critical care physician specializing in critical care pediatric medicine at Nicklaus Children's Hospital. That is correct.
Teen vaping. First of all, explain to our listeners what vaping is as opposed to cigarette smoking.
So there are a few differences, and vaping is basically a process whereby a liquid is heated and evaporates into gas, which is subsequently inhaled into the lungs. Much of the issue with vaping. Well, the hope with vaping was that for tobacco, people who use tobacco and cigarettes, the hope was that vaping would be a safer alternative for them because we know and we've known for years the many hazardous effects of cigarettes, which have been well established. I think a big part of the issue regarding vaping is that, this is a relatively new technology of which we really don't have the longitudinal data that we have with cigarette products. And also, as has been brought to light, unfortunately, within the past 6 months or so, many of these products have either come from outside markets, other countries, whose control process is not established, and it's not clear what other ingredients may be in some of these liquids.
Now, when it comes to lung function, lung health, inhaling smoke into the lungs is dangerous for obvious reasons, but water or vapor is just as dangerous. For the same obvious reasons. Isn't drowning something that we try to avoid? Why would we put water vapor into our lungs and think it was a safe alternative?
So that's something I don't quite understand. And I do agree that I believe that, inhaling something heated into our lungs or applying heat to our tissues in general for an extended period of time, I'm sure is not or does not have any healthful benefits, and in fact probably has detrimental effects. So to your point, yes, I think taking heated substance, vapor into our lungs, is in no way can be viewed as something that's healthy. Again, I think that the estimation here was regarding vaping versus cigarettes, because cigarettes have so many other chemicals in them which are unrelated to nicotine, which we know are carcinogenic. The hope was that vaping would diminish the exposure to others from these chemicals that we know are carcinogenic. But I think the bottom line still is that, people should understand this clearly, is that inhaling heated vapor into our lungs in the end is not a healthy alternative.
Now, we've all grown up with the knowledge that nicotine, cigarette smoking, is addictive, not just physically, harmful for obvious reasons, but actually addictive to where, you have to have it. Are we talking about the same addictive properties in vaping products that don't have nicotine?
So, this is this is an interesting area, and to answer the question, I don't think that there's an obvious a direct answer here, but there certainly is concern that the vaping can be addictive. Some of the liquids do contain nicotine. Some of the liquids do contain something called tetrahydrocannabinol, which is THC. That's a byproduct of marijuana, and cannabinoid oils as well, and as well as other flavorings and additives. So there clearly is a concern that some of these other ingredients may in fact be addictive, and added to that, the marketing strategies of these products, many of which are marketed in exotic flavors that seemingly would appeal to a younger population.
I would assume that developing bodies are at a greater risk for vaping, as would someone in their early 30s or even their 40s or even their late 20s would have. Is that an accurate assumption?
Well, so yes, there clearly is concern regarding brain development at earlier ages because the brain is developing at a more rapid pace in younger children than it does in older adults. And the concern is that there are a lot of neurologic connections which are formed in early life, childhood and adolescence, and even young adulthood. And the concern is that, especially with any type of THC-containing product, that affects what we call neurogenesis and neural networking throughout the brain, and especially during these critical periods of brain development. And in fact, there is some evidence, scientific evidence, which supports those concerns.
I've viewed some vaping activity online and on television and watching the news, and also just out and about. It seems that aside from the addictive nature of some of these products, that there are things that you can do with the smoke or the vapor that you can't drag on a cigarette or a cigar that much and do that sort of thing. It seems to be like they're playing with it more than actually smoking it. I've actually seen competitions with vape smoke. Is that part of the draw for vaping as opposed to cigarette smoking or tobacco smoking?
Honestly, I don't know the answer to that. But my observation has been this, just in general when I'm out and about. I've always made mental notes to myself when I see a large cloud of smoke coming out of a car or someone walking down the road and a large, cloud of smoke coming out of their mouth, from one of these products. I just, I do wonder, what is the attraction? And I do wonder, if that much smoke is coming out of someone, what kind of effects does it have internally, in their lungs and their respiratory tract? I don't know the answer to that either. So again, I would imagine, knowing adolescent behavior, that certainly may be part of the attraction here. And I'm talking about, your comment about using this smoke in some type of a way, that is somehow stimulating to a younger person or an adolescent, or seems fascinating to them, but I don't have a better piece of information to offer on that.
Where can our listeners get some more information about the health aspects and the clinical perspective on teen vaping?
Yeah, I think that the best sources of information to use within the United States are either the Center for Disease Control and Prevention, and their website is cdc.gov, and they have links. They have multiple links to e-cigarette use, vaping product use, and also they have updated information on the recent epidemic of acute lung injury that's been related to e-vaping. They also have nice links, which discuss the potential medical complications from using these products. And so I think that's really one of the nicest websites. Another nice website to use is called Medline Plus. It is a website run by the National Institute of Health. It's a wonderful resource for parents in particular, although it's also good for healthcare practitioners to read about e-cigarette use, vaping products, and their side effects and complications.
Thank you so much for joining us on the program this morning.
Oh, you're welcome. I'm really glad to have been a part of this conversation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.